We have arranged here to address you here today because, you know, we all should observe social distance, and I think this gives us enough space to spread ourselves widely so that we don't come into very close contact with each other. I welcome you to this press briefing to update ourselves on the measures that we continue to implement to contain the spread of COVID-19 pandemic and our state of preparedness to make sure that our people are safe from contracting COVID-19 or coronavirus. We note with concern the rising numbers of COVID-19 cases nationally, as explained and stated by our Cabinet Secretary for Health, Honorable Mutahi Kagwe, yesterday. We understand that the number stands at 42 as of March 29th this year. We as county government and the national government here in Kisumu shall continue to be vigilant to ensure that we do our best to contain the spread of this virus by taking certain measures and continue to learn from our experience nationally to ensure that these measures we are taking are in tandem with what is being done at the national level. We have developed a COVID county preparedness and response contingency plan. This plan has outlined a costed response activities implementation as well as response commodities equipment implementation plan that we shall hand over to you. All the COVID-19 activities are coordinated by a multi-sectoral county response coordination committee, co-chaired by me and the county commissioner, bringing together the national government actors in Kisumu County and ourselves. The committee has the overall responsibility of resource mobilization for the response, public advisory communication, implementation of the preventive measures, and review of the response strategies that are being taken from time to time. We have, over the last couple of days, trained 433 healthcare providers and sensitized a further 790 across the county. Disease surveillance has been enhanced with new faces immediately reported to the county COVID-19 response team. New cases reported to COVID-19 response team for necessary action. This coordination has so far led to arrest and quarantine of 11 suspected cases who had their samples taken for testing. So far, results from 10 of these cases have since returned negative. The 11th one is awaited. We have commenced procurement of infection prevention and control equipment for healthcare workers to supplement what we have received from the national government. But I dare say that the status of equipment availability is still very much wanting. Personal equipment, preventive material is not there enough. Test kits not available. At our referral facilities, we have equipped our own intensive care unit, but looking ahead, should the cases arise, this definitely will be inadequate. To that end, I shall be conveying today at 11 o'clock to the national government through our technical committee that will have a teleconference at 11, the details of what we did in Kisumu County. And I hope the response will be positive. As the situation unfolds, there has been need to upscale our capacity in clinical case management. We have since increased the capacity of our isolation centers. So far, Jaramogi Oginga Odinga Teaching and Referral Hospital has gone from 5 beds to 20. We have also set up 5 beds as isolation units at all of the 7 sub-county hospitals, bringing our installed capacity to 65 beds. Plans are also underway to expand the isolation center at Kisumu County Hospital to 200 beds. In the wake of the rising need for more quarantine spaces, we have prepared a 128-bed quarantine center at the Kenya Medical Training College here in Kisumu campus, which can actually hold more should the need arise. But we are beginning these 128 beds fully equipped with ablution facilities for those who would be quarantined there. But since the training college has more bed capacity, we shall expand it as the need arises. We have also set aside Victoria Hospital as an isolation center for healthcare workers in the unfortunate event that some may need to be isolated from their fellows. As you know, healthcare workers run a lot of risk that may themselves be affected, and so we have a special hospital at Victoria where they will go to be taken care of also. We have also identified this Sunset Hotel as an operation center for frontline healthcare workers who will be taking care of the cases in the unfortunate event that we end up with such cases. We continue to ramp up our communication with mass SMSs on coronavirus prevention and control, currently being sent out to the general public in the county every day. Between today and tomorrow, we shall also be signing contracts with some of the media houses for certain targeted commercials, or what is called informed commercials and kits. Fellow citizens, this county is currently grappling with floods, terrible floods, in Moroni, Nyando, Nyakach sub-counties. We have over 2,000 people displaced and housed in 5 active evacuation camps. This presents a new phenomenon, and these camps are themselves potential centers for the spread of coronavirus. So we have to deal with this situation. It requires very careful healthcare delivery systems and very thorough delivery of equipment that we should use in these places called evacuation camps where people are escaping from flooded villages. We have set up a combined disaster management team consisting of the county and national government officers. This team is already on the ground planning a response strategy. Indeed, they were in these places over the weekend and receiving their report now, and we shall implement the report that they give us. But this is a new demand on our resources faced with coronavirus. As a result of restricted movement due to coronavirus as well as current floods, the county is staring imminent flood insecurity. I want to appeal to our farmers to plant fast maturing and adapted traditional vegetables and crops such as cowpeas, osuga, dek, olai, oganda, and fast maturing maize varieties and sorghum. I do believe that the Department of Agriculture is ready to provide feeds to the farmers to this effect. To address the issue of traders from the open air markets, I hereby direct City Planning Department, the City Engineering Department, and city drivers to immediately report to work this afternoon here at Sunset so that they can be mobilized to work in the markets of Kowino, Kosao, Nyawita, and Manyata, where we are taking open air traders. Some of these markets still need ablution blocks completed and water. I have summoned the CEO of Kewasco here with me, and we'll be going to these places to make sure that water is available for the traders. It is very dangerous, ladies and gentlemen, for traders to trade in the open market. It is very dangerous because you don't know who is going to come and pick up things very near you. We can't maintain social distance in the open markets, but in the formal markets that have been built, as such as Kosao, Nyamita, Manyata, and so on, Kowino, we at least have enclosed places with proper facilities, and we can make sure that traders are trading safely, both for their lives and for those who come to purchase. So I appeal to all leaders at all levels, to work with us, and I appeal to the traders. We are doing this in their own good and in the good of the customers who come to purchase these commodities. We met with their leaders 3 days ago, and we agreed on an organized system of moving them to these markets. And I would just appeal to their passion, their conscience, and their commitment to life, to please work with us so that we can move to these markets and trade safely. I told them that the county government is waiving market fees for 1 whole month so that they can move to these markets and trade from there. We are prepared to lose revenue in order to save lives. So I do hereby appeal to all leaders to join us to make sure that these traders move to these organized places where we have proper ablution blocks, we have water and so on. People can wash their hands as they come. In an open air market, it's very difficult to organize sanitation properly to prevent customers and traders alike from catching this terrible virus. Ladies and gentlemen, finally, we know that we have a curfew declared by the national government. The president himself declared it, that we leave public spaces, whether it be the streets, the shops, and whatever, and we go home before 7. Please don't wait until 5 minutes to 7 to begin moving from Kisumu city to Kondele or Kisumu city to Otonglo. You will not get there before the curfew. We are giving the security forces an unnecessarily difficult time by not behaving sensibly and consciously. So I would like to appeal to all our citizens and leaders to please, please, please abide by the curfew time. Be home by 7 in the evening. Wake up at 5 and begin the day properly. But let us all go to our places of work, if we are still working, that is, or our trade, and do our activities between, and I say between 5 in the morning and please end by at least 6 so that you can get home in time and not cause the security forces unnecessary stress. May I invite the County Commissioner, Madam Susan Mureru, to address you, please.
Thank you, Governor, and thank you, members of the press. Mine will be very brief. Social distancing is still quite a challenge here. It looks like people are not taking seriously the issue of corona. It still looks like it is far away from us, and I would want that we take this thing seriously. We have to keep moving the market, the traders at the market, and yet it is for their own safety. So I'm appealing to all of us to take social distancing seriously. We are working together with the county government to see how we can help our traders, especially those dealing in food produce, because this is an essential service, to be in places which can be fumigated. The markets can be fumigated, and also we can have some level of enforcement so that we have a few people buying at a time. We don't want crowds. The same problem appears to have been what brought us to a point where we decided now that even the stage will not operate, the bus park, because again crowding was the problem and also other internal issues. So we are appealing to all of us. Social distancing is for our own good. Coronavirus is not something outside Kenya, it is within Kenya. And we need to change our attitude and see how serious this pandemic is. We are appealing also to those in the informal settlements. Tafadhali tukifika jioni, tuende tu nyumbani. Tuende tu nyumbani. Kwa sababu kuna pia mambo ambayo yanaweza tendeka usiku, na tutahitaji kusaidia wananchi. Naweza sema hapa kwamba kama jana nikizunguka kama saa 3 hivi nikapitia Nyalenda na nikapata vijana wamebeba mwenzao ambaye alikuwa mgonjwa. Kwa bahati mbaya huyo mwenzao aliaga wakiwa na yeye wakijaribu vile watampeleka hospitali. Bahati nzuri ni kwamba kulikuwa na polisi na sisi pia tulikuwa hiyo area, na tukazungumza nao na tukawasaidia na wakapeleka mwili kwa mochari, na jamii ya hiyo familia tukawaambia sasa, kwa sababu mwili imepelekwa kwa mochari, tunaomba tafadhali burudi nyumbani, na wakakubali. Tunajua kuna vijana pia wameamua sasa wakati wa curfew pia wanafanya vituko. Tumekuwa na visa huko Migosi. Tumekuwa na pia vijana ambao wanataka kuvuta bangi, wanangojea wakiona polisi wamemaliza kuzunguka kitu saa 3 hivi, wanafikiria askari bado hawazunguki, wanataka kusanyana mbele za maduka wavute bangi. Tafadhali, serikali imesema tukae nyumbani kuanzia saa 1 mpaka saa 11 asubuhi. It is for your own good. It is for our own good. Hii si mchezo. Watu wa pikipiki, watu wa tuktuk, munangojea mpaka imeshapita saa 1. Mnataka kuona vile mtakimbizwa. Hii si mchezo, tafadhali. Tuende nyumbani. Tuende nyumbani. Kuna wamama pia nakutana nao, bado wanataka kuuza, bado wanataka kupika. Tuende nyumbani tafadhali. Kutii imekuwa sasa ni balaa kwetu. Tafadhali tutii sheria. Tutii sheria. Na tumekubaliana kama County Security Committee, tukikupata tutafuata tu vile sheria inasema, kwa sababu wewe ndio hutaki kufuata sheria. So kitambo tuanze kupelekana mbio, bado tunawasihi tuende nyumbani. Saa 1 ikupate nyumbani. Na kama kabisa kuna kitu imekufanya haujafika nyumbani saa hiyo, tukikutana na wewe ukijieleza, tutakusaidia. Sisi ni binadamu kama wewe, tutakusaidia. Lakini sio wale sasa ikifika saa 1 sasa ni tuchunguliane, tukimbizane. Hapana. Tafadhali tuende nyumbani. Hili ni janga ambalo limeathiri dunia yote, sio sisi peke yetu. Wazazi tafadhali, ambieni watoto wakae nyumbani. Saa 3 saa 4 nakutana na kijana wa miaka 12 hivi. Anafanya nini nje? Nakutana na vijana pia wamekaa. Tafadhali wazazi, watoto walitoka shuleni ili wakae nyumbani. It is our responsibility to take care of those children. So tafadhali wazazi, tuongee na watoto wakae nyumbani. Vijana ndio wanatusumbua. Mbio kila pahali. Tunawasihi tafadhali, ikifika saa 1 tuwe sisi wote nyumbani. Tunawaambia pia wanasiasa, tafadhali zungumzeni na watu wetu, muwaeleze mambo ya COVID-19 because tafadhali tunataka iwe pahali ambapo mtu mmoja anauziwa na anaenda. Tunataka hizi soko ziwe na maji, watu wanawe mikono na sabuni, na pia waende, ni wengine wasaidiwe. Serikali pia imeleta sanitizers. na tumedistribute kwa chiefs na assistant chiefs. Tumewaambia mpatiane kwa wananchi na muwaeleze jinsi ya kutumia, kwa sababu hii ni kitu mpya. Watu wengi hawakujua sanitizer ni nini mpaka ili janga lilipokuja. So tunataka pia chiefs na assistant chiefs mkipatiana hiyo sanitizer, munaeleza wananchi sanitizer inatumiwa aje, tusije tukajipata kwa shida ingine na hiyo sanitizer. Inapoendelea kukuja tunaendelea kudistribute. Na tafadhali tunaomba mwananchi, kwa sababu tunajua kuna vijana ambao wanaleta shida hapa na pale juu ya usalama. Kukiwa na shida, tafadhali tuma message kwa nambari 988. It is toll free. Kama kuna kitu kinatendeka pahali huko, kama kuna vijana wako na nia mbaya, tuma message na utuambie ni wapi, tutatuma askari haraka iwezekanavyo. Nitarudia hiyo namba 988. Kama kuna mtu ambaye amekaa nyumbani, alitoka ng'ambo, haja quarantine, tutumie ujumbe kwa hiyo namba 988 ili tuone vile tutajumuika pamoja na watu wa afya, azungumziwe na asaidiwe. Hakuna haja ya kujificha, kwa sababu kama wewe kwa bahati mbaya uko positive, wewe ndio utaumia kwanza. Najua wengine wanaogopa kusema, hawataki kwenda quarantine, lakini it is for your own good. So asanteni sana.
Asante sana County Commissioner. Maswali? Anybody with a question, clarification? Yes, sir.
Yes, you mentioned that we have about 5,000 residents of Kisumu displaced by the floods in the country.
2,000.
2,000?
Yeah.
Yes, so now, the first question, do we have any immediate evacuation camps?
Yes, we have. We have evacuation camps. In fact, that's where we're meeting now to know exactly what situation is in those evacuation camps and what is needed in view of the new coronavirus situation. That's the purpose of the meeting we're having this morning. By the end of the day, we should know exactly what we need and what should go there. But at least our people were there yesterday. Madam Ruth Odinga and her team, she's the head of disaster management, and Dr. Manga from agriculture and Idris Omondi, they were there, and they've collected necessary data which we definitely use to respond to the flood victims. Yes, madam.
Especially at the provincial level, we don't have screening centers and the capacity to separate patients with maybe COVID-19 symptoms or respiratory symptoms. How soon do you plan to?
We have, at least in all our sub-county hospitals, facilities for isolating those who have been identified as suspicious cases. In most cases, when people need testing, they send them straight away to Kisumu to be tested. So there's a system of coordination in the health department to make sure this goes on without any hitch.
Do you have any plans for massive screening?
Massive screening is a national government initiative. At the county level, we cannot initiate it because there's a protocol to be followed when massive screening is taking place. It's not an easy thing. It's very expensive because you have to test it. So I suppose that's one of the things that the technical committee will be discussing.
As you sensitize your healthcare workers, do they have capacity to address mental health issues coming as a result of COVID-19?
Yes, I know that was debated yesterday on TV, mental health issues. It is something that will be a work in progress because you deal with mental health issues as they arise and get the specific mental health specialist to deal with that. Yes, Agwanda Jakorando.
Yes. One goes to you, the other question goes to the Chairman of County Security Committee. Madam Susan, we're aware of the curfew is as a result of the National Security Council meeting. It's a nationwide thing. Why is enforcement of the said curfew in Kisumu County, particularly the urban areas, more so the settlements like Manyata, Nyalenda, and what. Why does it seem to be different in that the law enforcers seem to be criminals more than people who are entrusted with enforcing the law? An example is you find that most of these operations are coordinated by a gazetted officer of Kenya, our National Police Service, in the rank of either chief inspector or an inspector. These are people who seem either not to know what they are doing or going to an extreme.
I'm going to be precise, please.
Okay, what I'm saying is, Excellence, is that what I'm asking Madam Susan is why a Kisumu police officer seems to be extreme in enforcing this curfew, unlike in other areas.
Okay.
And if you look at what Mr. Edward Mbugua, who is in charge of senior police, is order. Totally, what they are doing is totally against it. Then to you too, I was in PC and Nyamira and part of Magay. Things are going normally, markets and whatever. Why do you seem to want to make Kisumu a pilot project for coronavirus control?
Well,
Economic involvement of people. You are seeming to be determined that this thing must not here in Kisumu. Why are you different from other governors? We got to purchase food in a bigger county. Tichilo has done nothing about it. Markets are going on.
Yeah. Well, Kisumu is different. Kisumu is a cosmopolitan city. People come from Uganda, Tanzania. It's a transit center. You know that from here we go to Busia to Uganda. And it's also cosmopolitan in terms of people who live in Kisumu. The other day there was a priest who went to Ugenya. You know the story. There was a whole bus from Ombei who took people to that funeral. Unless we take preemptive action, we don't know what happened to those people at that funeral. We don't know how many people they were in contact with. So we're just taking precautionary measures to make sure that innocent people like you don't get that coronavirus in an open market where you go and buy food from somebody who never washed his or her hands in selling that food to you. So it is not really a pilot project, as you say, that's rather cynical, Ms. Agwanda, but it is a practical project in the sense that we know the reality of coronavirus and we are trying to respond to it in the most practical and sensible way possible. And we have discussed with the traders, by the way. We met with them here, the leaders, and they are agreeable to what we have proposed. The problem is implementation. As you know, that it takes people a long time to believe that they can get coronavirus until actually it happens at their doorstep. We don't want to wait that late. We want to make sure that Chakoton